It is 11:05, time for the PinPoint Health Show, and welcome aboard. The phone lines are open. You have questions, concerns about your health. We all do. I went in for a
what?
Cataract appointment.
And? You need surgery?
Yeah.
Uh-oh.
Right eye.
Yeah?
Nice when you're 48.
What happened? What were the symptoms?
I'm old. I'm dying.
No, but with
blurriness, yeah. My right arm. I've had LASIK. I had laser
okay.
10 years ago, 12 years ago. It's phenomenal. But I'm old, man.
And now it's starting
I'm
to
old,
break
bro.
down.
Yeah,
You're not diabetic, no.
No.
Okay.
Dude, I'm keto.
Yeah.
Keto and diabetes don't go together.
Wow.
It cures diabetes.
Okay.
All right, here we go.
Here we go.
We are ready for your phone calls, by the way.
Actually, theoretically, you're right.
Yeah, but it can. It can. But
it can manage it.
You manage it.
You manage it.
Yeah. 416-870-6400. I know.
Four-letter C word.
Yeah. Anyway, Dr. Payne is here answering your phone calls, your questions about your health. How's your week been, buddy?
Good. Yours?
Good. Except for the depressing cataract thing.
That's okay. You'll survive.
Yeah.
Very busy week. There was an incident that happened yesterday that I would like to talk about, but I'm going to talk about it in a censor some parts.
Yeah.
It's essentially someone was getting, this is not through a person that came through the radio show. They just happened to, I guess, live near one of the clinics.
Okay.
They went for therapy. This person was unhappy about something and essentially made an absolute scene. Like, just started yelling at everybody at our clinic, started yelling at reception. Our manager went over, yelled, followed him to his car.
Greg's going, welcome to my world right now.
Yeah, exactly. Like, just an absolute disaster. My manager called me to try to speak to this person. I couldn't even get a word in. I have, like, the message. If you hear the things she says, it's absolutely ridiculous. And the only reason why I bring this up is I've said on the show hundreds of times, any issues I want to know about.
Yep.
But I always preface it by saying, in a respectful manner.
Yes.
Thank you. There is no reason that someone should act the way that this person acted. It was absolutely horrible. And in fact, once I got the story from both sides, because I heard it from her, and then I spoke to the physio that was treating her, totally different stories, which is fine. That doesn't necessarily mean that I'm saying I side with the physio. But at the very least, if you want my attention and you want me to help solve a problem, I don't know how yelling and saying some obscene things, like completely irrational things, like can get us anywhere. And you know, to the point where this person started saying, "I'm calling the police," and I was like, "Please,
do me a favor.
You should."
Beat me to it.
Yeah, it was just absolutely disastrous, and there's no space for that in my office or anybody, any business. I don't care what it is. I bring this up because if you ever want to get something, I always think going about it in a respectful way is the right way to do it. I mean, I'm very happy, as I've always said, this person could call the radio right now if they wanted to, and I will speak to you. Mm-hmm. But speaking is a dialogue. I was literally on the phone trying to get a word in, and she told us to shut our effing mouths. Like, just
very nice.
Yeah, like I couldn't even get in a word. And she was like, "You're not listening." And I was like, "I hear everything that you're saying. You know, I want to find out what the truth is. How can I do something to make it better on everyone's part, et cetera, et cetera." Just so, anyways, the point being, if you have problems with me, with my organization, I want to hear it. But I want to hear it in a respectful way. I want to make sure that everyone is getting the care that they deserve, which I know that they were. This is definitely some type of issue. Like, it's more than just something, because this person just went from being, the therapist said, from being absolutely normal to just losing their mind, just absolutely losing it. And then everyone that I spoke to, because then I sort of did my own investigating, and it was just like she went from 0 to 100 in a matter of seconds. And it was just like, there's got to be something more there. And, again, issues, happy to hear them, but in a respectful way. Please,
it's funny you mentioned that too, because, and I know you mentioned this before, that you've said this on this show with people's physical conditions, and the way they come in with their attitudes, good or bad, just their attitude.
Yeah.
You don't know what's going on in the background of their life, and you get that, but just, man, settle down with the F-bombs.
But but it's not only that, it was everything about it, the screaming, the yelling, the thing, not allowing the other party involved to speak. Like, it wasn't just me. My manager couldn't speak. Our staff couldn't speak. The therapist couldn't speak. It's just like, how can you possibly have a dialogue we were all willing to sit there and listen and figure out what the problem. We don't even actually understand what the problem is because it was just an absolute like gong show. Like it just went
just
crazy.
Bitching you out.
My God, I've never been spoken like that to. My manager said like in his whole career, he's never ever like this person followed him. Because we have 2 clinics that are across the street, right? And so he was walking to the other one.
Yep.
He had to literally like divert, go get into his car and drive away because he was sort of scared.
That's nice.
Crazy stuff. PinPoint Health.
Welcome to the show. You want to call? We'll take your calls. I see you there. We got a call coming in already. And for you as well, plenty of room, plenty of time. 416-870-6400 star 640 on cell. PinPoint Health Show just getting warmed up. Global News Radio. It is 11:13. PinPoint Health Show. PinPointHealth.ca and 1-855-55 Lou DRLU to reach out when the show's not on the air. But as far as the next 45 minutes, what?
No, sorry.
Okay,
sorry,
45.
I'm bad. Sorry.
As far as the next 45 minutes is concerned, 416-870-6400 star 640 on cell. Panitha, hello. Thank you for hanging on. Good morning.
Good morning. Thank you for having me in this show, Dr.
Thank you.
Of course.
I have a pain. The pain is on my right side. And I know I used to go for therapy because I had the tailbone at the bottom.
Yep.
The disc is slightly moved, and I went for therapy, physiotherapy, and it didn't help me. And it's now 2 years.
Yep.
And what I'm feeling is it's very frequent. My bone, it's my right side leg. From the feet on, I feel the numbness here and there, including my hand. And then lower back, I have I think my bone, I feel the bone kind of cracking or something. That's how I feel here and there.
Where do you feel? So I'm a little confused.
It's the lower hip.
So when you say right side, are we talking about just the hip or the whole right side of your body?
Whole right side of the body.
And you're saying that on the right side, on the hands and the feet, you're feeling numbness, and you're feeling a pain in your hip area. Is that right?
Yes.
Am I understanding?
Yes.
Okay.
Yes.
And you've got therapy for what? The hip issue previously?
Yes.
Okay. And how long has this been going on?
Now I'm feeling more intense. Like it's like almost every other day I feel that, but it's been going on since April on.
But I thought you said it's been 2 years, or no? Am I missing?
2 years. Yes, I had it 2 years.
Yeah.
But it's more severe now from April on.
When did you get the physiotherapy?
2 years back. I wouldn't able to recall exactly which month I went for it. But it's 2 years back.
And when you did the therapy, did you feel better after that?
Yes, I felt better.
Good. Were you given any exercises that you should be doing?
Yes, I was. I was doing it. Then it kind of slipped away, so I couldn't able to do it.
Then there's one of the issues right there, right? So the whole reason when any type of professional gives you the things that you then need to do at home. This is, again, I started this show with John saying don't use the cure word. We're talking about management here. So you can have a pain. I'm not sure of the diagnosis in your right hip. You get it treated with passive intervention like physiotherapy, chiropractic. Very, very good in the acute scenario. But then you have to be shown the exercises that you need to do, the stretches, a combination of things, the right movement patterns, the right posture. You need to be doing those things then for the rest of your life, because that is now a sort of, I'll use the term, a weak point that you yourself have. Once you've identified that weak point, you have to do those things in order to manage the issue. And unfortunately, if they do slip away, then it's not all that uncommon for these things to come back. Now, you've said since April it came back. Did you go get therapy again in April?
No, because I need a doctor's referral, and my doctor is away for a while now.
Well, is there no one covering the practice?
No.
And any walk-in clinics?
Yes, I go, like if I have any headache or something like that, fever, I go to the walk-in clinic. Otherwise, I really don't go for the walk-in clinic.
Right, but I mean, if your doctor's away and you need a referral, then I think that's a good reason to go, right? That's why they exist. So, I mean, I think that's part of the problem here is it's come back. It likely needs intervention, and then it needs exercises and posture modifications, whatever it might be, all to get you back there. Now, this is me. I don't know what the diagnosis is, right? I don't know exactly what's wrong. I'm just making the assumption that whatever you were previously diagnosed with is the right diagnosis. The other alternative is getting it reassessed. And in getting it reassessed, you can determine what the right treatment pattern is, because I mean, one-sided numbness of the body is more than, I would start to think of things that are not just musculoskeletal related in the hands and feet. How old are you?
I'm 52.
And any diabetes?
No.
No, okay. Yeah, so I mean, I'd want to investigate other things. I'm happy to see you if you like, and sort of go through a full assessment and figure out what's going on. But again, if it is at the end of the day a mechanical issue, these mechanical issues in their acute scenarios do very well with passive interventions, whether that be physiotherapy, chiropractic, massage therapy, medications. But then long term, it really becomes about the exercise rehabilitation, posture modifications, education on the right things to do, the wrong things to avoid. That's sort of the way you have to manage these types of pain and injury problems.
So if I would like to see you, how do I? This morning I went to your site and then I gave my details and then I submitted. So that means I will be getting something.
100%. Somebody will be calling you back either today, and if not today, on Monday, but likely today.
Likely today?
Yep.
And I also have a question.
Yep.
I have a OTIP, Ontario Teachers Insurance Plan.
Yep.
So you accept that?
Yeah, we accept all insurance. So here's the thing about insurance. It very much depends on the insurer. It's not based on us. We work with all insurance companies. It's a matter of
the policy, right?
Yeah, it's the policy. Like if you mean in terms of direct billing, things like that, we will do whatever the stipulations of the plan outline. If the plan outlines for direct billing to be possible, then we will do that. And again, this depends on the service, right? So if it's something that is OHIP-based or insurance-based, or some things like PRP injections are private-based, right? You have to pay out of pocket. So it really depends on the service. But, yeah, definitely we will do our best to, not just with you, with everybody, we try to make this as hassle-free from an administrative perspective for all of our patients.
Okay.
Okay?
Thanks, Benita.
Yeah, you'll be hearing from someone soon.
So much
yeah, no problem.
Of
course.
Thank
You're
you.
welcome.
You too.
Enjoy the rest of your weekend. You want to reach out further, again, 1-855-55 Dr. Lou, DRLU. But for the purpose of the remainder of this hour, the next 40 minutes, you have questions about your own health. Bring them on. 416-870-6400, star 640 on your cell. Pinpoint Health Show, Global News Radio. 11:23, Pinpoint Health Show. info@pinpointhealth.ca, and to reach out when the show is not on, 1-855-55 Dr. Lou, DRLU. But right here and now, 416-870-6400, star 640 on cell. Phil, thanks for calling in, pal. Good morning.
Morning. How are you?
Good, sir. What's up?
I've got a 55-year-old male, and I've had a problem with my right knee for some time, and I finally got it looked at and had an MRI over some time, and that. I've got torn meniscus.
Yep.
And she said it's being caused by I have osteo in my right knee. So she said they could scope it, but then they said it would probably just re-scrape because of the knee.
Yeah.
So I was given the option of a knee replacement, but I'm 55 and I'm a freelance worker, so I can't take 6 or 8 weeks off to have that done. So they booked me for about a month from now for a cortisone shot.
Yep. Okay.
So I'm just wondering if, and then she recommended a certain kind of brace that pressures the inside of the knee. Is that a good way to go, or should I've heard things about cortisone shots too, so I'm a little mixed. I'm not sure how I feel about those either. I've never had one before.
Yeah, I think as a one-time intervention to see if it provides any relief, it's worth it. They typically don't, but there's also, it's one time, they're very inexpensive, so I usually think it's a worthwhile idea just to see. In all honesty, in my experience, it probably won't do much. It sounds like you have degenerative tearing of your meniscus. I'd be interested in understanding how bad the osteoarthritis is, because that sort of will determine potentially when the right point for a knee replacement is. I do agree. I think you're a little young for it. So if you could delay it, that's good. The big thing that I think is missing, I think all of the recommendations are not bad. But I think the one thing that is probably the best option, and I typically, when I see a patient like you, I'll sort of draw them a spectrum of things that are available to treat this type of thing. And it's like therapy, injections, to surgery, right? And I always go from most conservative to most invasive. I'm always a fan of start with the most conservative options, exhaust those, use those as much as possible because they're conservative. When required, potentially use more invasive options like a cortisone injection, and then eventually planning for a knee replacement. So I think the one thing that you're missing is potentially doing therapy to strengthen the musculature. There is very good research where if you do this properly, and when I say therapy, I mean exercise rehabilitation. I don't mean a machine on your knee or someone just poking around. It needs to be exercise-based. But if you do that, you'll strengthen a lot of it. That'll minimize a lot of the symptoms. Then, maybe you can delay the injections, manage it with that when potentially you require it. Maybe the injection might be a good idea. The scoping is not a bad idea. It probably will happen again, but it's not definitely a long-term solution. But instead of jumping, I guess what I'm trying to say is why jump to those more invasive options right away when you're missing out on the conservative option that is not invasive at all, which is the exercise rehab.
And plus, I'm a little extra weight as well. I'm probably about 50, 60 pounds overweight for my frame as well. Now, that'll make a difference.
Oh, yeah. I mean, there's about anywhere between 4 to 7 pounds of pressure per pound of your body weight. So if you're overweight by that much, then that's all, times 4 to 7 is the amount of extra force going through your knees. So that would help tremendously.
Oh, perfect. Okay, thank you very much.
No problem.
Thanks, Phil. Appreciate that. Follow-up again is info at pinpointhealth.ca. I'm just thinking about that, what you just said about that. That is incredible, the amount of extra weight per pound.
Yeah. And that's for everyone, but I'm saying it's not extra pound. It's all of your body weight, like every pound of your body weight. It ranges between, depending on what study you're looking at, 4 to 7 pounds of pressure through your joints, especially the hips and the knees and the ankles. So obviously one of the big things with knee issues is being overweight. If you're overweight, if you can lose... I mean, even if we did like something as small as 10 pounds, could potentially be 70 pounds of less pressure through your joints. So that's huge in terms of osteoarthritis management of the knee and that degenerative fraying of the meniscus, because you can get tears in the meniscus and they're not all traumatic in terms of like a sports activity. You can have the ones like this gentleman called about, which is more of a degenerative fraying that happens as arthritis builds up.
It makes you think we all got to lose some weight. It's amazing that a joint, a knee, as you said, or a hip would last 80 years under those circumstances.
Yeah, and that's unfortunately why they don't, right? That's why there's so many knee replacements and hip replacements being done, because they also just break down so far that it ends up causing a tremendous amount of pain for individuals. And I mean, if you're at the point where the osteoarthritis is very severe, then really at that point, the best management that we do is refer to the surgeon for a replacement. That's really the best option. If you're mild to moderate and those symptoms are starting, there's definitely other things you can do. And, I'm happy to go through those things with anybody, but there's definitely more conservative options. And, what he spoke about, bracing, medication, injections, therapy, those are the things, I had a person that came to see me, was it this week or last week? I believe it was this week. It wasn't a knee issue. It was a back issue. And they essentially gave me the history of what this back issue was. It was chronic low back pain. That's what it was. It was a chronic issue that had been happening. And, when I gave the options in terms of like therapy, injections that could be done, not a surgical, it wasn't a surgical type of case. They basically said, well, I've done that and nothing's worked. And it's like, and they were sort of like, I need you to give me another answer. And I was like, but I can only give you the answers that exist in the world, right? Like I can't tell you I can't make something up for you. And I think there needs to be that realistic expectation when people come to see me. I'm not someone that's selling some specialized tool that's not available, that is only trademarked by us. Really, what I'm doing is just providing the right plan of management for these types of issues. And, you know, if you've tried these things and they don't work, the other question becomes, have you tried them in the right way? Have you tried them long enough? And, you know, are you being realistic about what your goals are? And those are the things that I'll go through with everybody. But it was sort of interesting to think, like, this person wanted me to come up, like, you know, basically said, I need you to tell me something else.
Right.
And I was like, but there's nothing else.
Yeah.
Like, I'm just talking about in the realm of possibilities that exist. Like, I even gave some more alternative options that I usually won't recommend that don't have great evidence. I said, here are some other options. Oh no, tried, won't work, didn't work.
Okay. That's all I got, son. Yeah.
But the one thing that people really, really need to understand with this stuff, with chronic issues, is how important the rehabilitation is. Right. And the problem is when you talk about therapy and things like that, everyone's always focused on the passive stuff.
Yes.
The active component is huge. It's the more important component with the chronic issues. And those are the things that people often lack. Therapy is often lacking in terms of what people recommend. The therapist, that's why we're trying to create a model of care that does this the right way.
We're going to dip into that a little further. In the meantime, you want to call and ask some questions about your health, do it. And this is the time, 416-870-6400 star 640 on cell. Pinpoint Health Show continues. Global News Radio. And up until 12 o'clock, Pinpoint Health Show, 416-870-6400 star 640 on cell, on social. Pinpoint Health. You can check it out on Facebook and Instagram. Again, some great videos this week on Instagram. I saw the one with the dead bugs and the Swiss ball. Fantastic lower back stuff. Really low impact, but stuff people should be doing, even if they don't have a physical problem. It's great stuff.
I mean, so most people don't have, like, most people that have chronic back pain don't have acutely aggravated low back pain. Okay. What they have is that chronic low level ache, right? And that's what I'm talking about. That's where these exercises, that's what they're targeted for. To like, when I talk about this, I talk about it because that is the best evidence-based approach to chronic low back pain, is you need to build up strength in your core. That's not me saying it. That is the consensus in the scientific community about low back pain. I am just simply a tool to relay it back to the public. And it is incredible how many people come see me with chronic low back pain, and through their own, you know, not wanting to do it, through a combination of maybe the therapy that they've currently been receiving, not recommending it. I'm recommending people that often stay within our clinic have already done therapy. What I'm saying is now go get rehabilitation. And we have people who are essentially running them through this rehabilitation, showing them these things. And these are the people that do well. This is how you manage chronic issues, chronic neck pain, chronic low back pain, chronic shoulder issues, potentially some chronic knee issues, any joint problem, any musculoskeletal problem. If it's chronic, it likely requires rehabilitation. If you're not being shown that, then that's a red flag for the place you're going to, which I try not to dissuade anyone from going anywhere else. I'm always transparent, telling people you can go anywhere you want. But if you're going somewhere like that, maybe you have to reconsider it. And if you're looking for a place that will give you the right approach towards these types of issues, Pinpoint Health is the place for you to go potentially. The next thing is, stop being lazy if you're the one being lazy. If it's you, the person listening, who you've been told this and are just saying, well, I don't want to do it, or calls like we've had where I was doing it and then I stopped. Well, then, surprise, it is going to happen. Yeah, this is not a surprise to me. This is exactly what happens. And so, take accountability for that. This is part of pain and injury management, is a lot of accountability on the individual. You have to do the right things. If you don't do the right things, do not be surprised that the issue that you have comes back, gets worse, takes up more of your time, makes you lose time because of injury. This is the sequelae of what happens. And yeah, if you're young, they tend to go away pretty good, and then they come back and they come back and they come back. And that's why a lot of people that I hear, the story's not too far from swaying from something like, I've had this for 30 years. It used to be fine. You would get better right away, a few days, pop a couple pills, I'd be fine. It happened once a year. Now it's happening 3 times a year, to the point where I had to go to the emergency room. They didn't do anything for me. It's like, well, they're an emergency room. That's a whole other conversation. They want to make sure you're not dying in the next 72 hours. Yeah, they're not there to manage your chronic low back pain. There's better places for that. And, I've tried everything and nothing's working. Have you rehabbed? I did some stretches. That's a lot of what I hear. I've been shown stretches. That's not strengthening. If you've been shown stretches, you're probably on the wrong path. It should be more about strengthening for the core than it is stretching of the core, because most people need to build up strength and endurance. And when I say most people, I mean like 99%. Right? So if you've not done those things. Now, that doesn't mean that the passive interventions, like the modalities that exist, like acupuncture, IFC, manipulation, manual therapies, whatever, amazing in the acute exacerbations, right? Amazing for the first 6 weeks of an attack or something like that. After that, though, you got to get back to the exercise component. If you don't, then, again, don't be surprised.
It's amazing if someone gets a cavity or a root canal when they leave the office. Now, remember, brush your teeth 3 times a day.
Brush your teeth,
of course,
floss.
no problem. Do it every day. This is the same thing.
Yeah, and if you don't do it and it comes back, you know why it came back.
Exactly.
This is the exact same thing. It's a great analogy. This is doing these exercises is the equivalent of brushing your teeth in order to maintain the integrity of your teeth. Yeah, and this is how you maintain the integrity of your body.
Again, PinPoint Health on social anyway, especially Instagram and Facebook. Some great stuff there mounting every week. It's really good. It's really cool how you've taken hold of that aspect as well. info@pinpointhealth.ca is the email address. And for the remainder of the time here, of course, 416-870-6400, star 640 on cell. Again, I point to my sister-in-law, who is pretty steadfast in her exercising, which she really shocked me over the last couple of years, because, I mean, she's pretty on the ball, but she's really, because she had a lot of...
Well, she had a scary period there.
She had a scary period, a lot of reciprocal stuff. It wasn't just physical. It got into her head, and it scared the crap out of her.
It scared the fact that she thought, like, I don't want to be disabled. Like, I don't want to have a disability. Yeah. And it was very simple. It was like, well, you need to do the right things. And I think, that's not all that different than people who, you see and they're in great shape all of a sudden. And it's like, what happened? Oh, I had a scare with my heart, and it changed the way I look at it. Like, physical problems, sometimes it takes that. It takes a scare of, feeling what it's like to not be able to move around. My sister has gone through it a few times this year, where her back has gone out. And we treat it acutely. And I've kept telling her, now you need to be building up your core strength. And I'll be honest, she's not doing it. But, one day she'll get to the point where she'll say, okay, now I have to do it, right? Yeah. So I mean, don't wait, though. When you wait, you create so many more problems. Do not wait to do the right things for your pain and injury problems.
And there's a point where there's no turning back. You're going to have to live with a certain amount of it because you didn't take care of it, nip it in the bud early enough, right?
Yeah, and a lot of times these people, it's not even the pain, it's when it's the function. Like, if you throw your back bad enough, you're not getting out of bed. Yeah. And most people will say, I'll take the pain, but I need to be able to, like, go to work and move and do things.
That's the way it goes. 416-870-6400, star 640 on cell. Call us. You have some issues, bring them up. Even if it's not for you, for a friend or a family member, on their behalf. Got about 20 minutes to make your call right here. PinPoint Health Show, Global News Radio. Yeah, still got some time to call through. Do yourself a favor. Get it rolling. Get some basic information before you carry on. Update on the clinics, pal. How we doing? There's 5 and building, right?
5 and growing. Yeah,
really doing well.
Doing well. We are working on a couple other locations for, again, just expanding into areas where there's a lot of need. It's going amazing. We're starting to grow the team. Where the knee clinic that we've been doing has been going so well. We're actually now working on a shoulder clinic. To sort of expedite those things. So, any shoulder issues, give us a call, because it's sort of, we're in the hybrid model, but we can definitely expedite things that might require surgery. And again, I'll always say this. We're not looking to give people surgery. What we're looking to do is identify the people who probably need early surgery in order as a good intervention. And that's essentially what we're doing with the knee, right? People who have an acute injury, maybe you've torn a meniscus playing a sport, an ACL, you don't want to be in the system waiting for months and months to be getting a surgery that you likely need, and then diminish your prognosis. There's a way of getting that quicker. You can give us a call, 1-855-55 Dr. Lou, DRLOU. And from there, we can go through some screening questionnaires and see if you're a candidate to get in sooner. This does not mean that if you have a chronic, like we get people that call us and we're happy to take the call. But if this is a chronic issue, then you don't need surgery right away, right? Probably you don't even need surgery. It maybe requires management in other ways. But what we're really trying to do is identify the acute scenarios that likely require an immediate surgery.
Speaking of the chronic scenarios, you mentioned shoulders now. Is the PRP something that would carry up to a shoulder? I mean, figuratively and literally, or no, it's not the right term?
Yeah, so the PRP is done for a lot of joints. Okay. We very much, again, because what we try to do is create evidence-based care, or not create, what we try to follow is evidence-based care. Evidence-based care means best scientific literature, clinical experience, and what the patient wants. We very much have stuck with the PRP for knee osteoarthritis because it's got very good literature to support it. The surgeons that are with us find clinically it works really well, and people want to do it. We do sometimes do it in other joints, but the research isn't as great, right? So that doesn't mean it doesn't work. Okay. Maybe the research just isn't there yet. But we definitely try to move towards an evidence-informed pattern. The reality with the shoulder, though, because of its complex nature, a lot of the times what the problem is the rehabilitation component, right? Where you're working on the structure of the scapula, positioning, because you can, like, we're all sitting, we're all doing stuff in front of us, our shoulders are rounded forward. A lot of these things, it's not really about an injection or surgery. What it's about is changing that posture, changing the angulation, and really working on improving the function from that standpoint. And typically I'll show people, when I test their shoulder, I get them to sort of the way they would naturally sit, and I'll do some orthopedic tests, and they say, yeah, that hurts, that hurts, that hurts. And I say, okay, that's interesting. Sit like this. I move their shoulder a little bit. I put them in what would be an ideal biomechanical angulation of the shoulder, and I do those exact same tests. Doesn't hurt, doesn't hurt, doesn't hurt. Well, what does that tell you? You know, you can do a surgery to a tendon or something, but if you're still in that inappropriate biomechanical posture, you're going to put strain on it again and the pain will come back. However, if we can work on, from an exercise perspective, changing the angulation, the biomechanics from that functional perspective, the outcomes are great there. And that's why it's not just about the fact that, you know, it's just, that's usually the best thing for shoulders, is really getting the proper rehab in them. So, you know, but there are instances where tendons tear, bad things happen, and you do need surgery quickly. And obviously, again, anytime if what you need for the diagnosis is surgery, and all you're doing is delaying that, you're diminishing prognosis, right? And if you're diminishing prognosis, that's not good for you. So if there's a faster way for you to get in, which there is by giving us a call, then that's a great thing. That can get you in sooner and get it done. Now, of course, if you don't want surgery, you don't get surgery, but we're not looking at it for pain. We're looking at it for function. Like, if there's some people out there that have torn a tendon and don't have any range of motion, all the rehab in the world isn't going to bring that back. But if if we can repair that tendon, or one of the surgeons can do that, we can work on getting that range back. And we've talked about so many times in the show, pain and function quite often do not go hand in hand. Yeah, right? Well, they can be the same, but they're quite often different. Yeah, and I guess what I'm saying is, it's always, I had a person that came in through the radio that had an issue, and I actually ran it. They're getting therapy at the clinic now. I ran into them the other day, and I was speaking to them, and I said, "How are you doing?" And he said, "You know what? The pain is the same." He said, "I'll be honest, the pain is the same, but my function is totally different. Like, I can feel that I'm getting more movement. I'm doing things that I haven't been able to do." And I'm like, that's great. Pain is secondary to function. Pain is a result of the breakdown of function. So as you start to build, and I explained that to him, and I said, once you get to the point where you get that function back that you had once upon a time, the pain will just sort of go away. And he said, like, listen, at the end of the day, even if I had to live with this pain, just to be able to have the function back to do the things that I want to do, that already is like the biggest difference. And that's really a lot of the times what we're working on is the function, because, again, pain is a result of a breakdown in function. And so we can't just target the pain. What we also have to do is target the functional aspect of it, change those functional things to more ideal scenarios, and then pain likely goes away as a result of it.
See, it's funny, and the way he sounded positive about that particular patient, because even though the pain's there, and pain is pain, none of us like pain, just having the functional capability returned to some degree has also had a mental component, which has been positive to it as well.
100%. And the other thing that I'll credit is our therapist who educated on that.
Okay.
So a lot of people aren't ever told that that's the way it happens. Even after our therapist will always go through, with people saying, you might feel worse. And he actually said, he was saying, after the therapy sessions for the first 24 hours, he's like, I actually feel worse.
And that's when people have to tough it out.
And people need to understand that, because I've heard this a million times from just casual conversation with people like, yeah, I went to go get therapy for this. I felt horrible for 48 hours, so I never went for therapy again. And then magically 5 days later, I felt amazing. It's like, well, that's not magically. That's what happened. But it's not their fault. They've never been told, right? So we make sure we let people know, hey, you might actually feel worse for a period of time, because we have to intervene. We have to break things down. It's like, if you go work out and you work your chest, it feels much worse for the next 48 hours.
Better.
Yeah, exactly. It hurts like hell, but people appreciate that when they're working out. And what have you done? You've made it stronger 72 hours later, because now muscle fibers have repaired. It's stronger than it once was. That's exactly what we're doing in therapy. So that up and down happens naturally, because that's a result of getting better.
We'll take a short break. Last few minutes, you want to slide a call in. We'd love to hear from you. 416-870-6400. Star 640 on cell. Pinpoint Health Show. Global News Radio. 11:52. Last few minutes here. You still got time. 416-870-6400. Star 640 on cell. You have a physical issue you at least want to get some understanding of before moving on to possibly going to see Dr. Lou at one of the clinics, pinpointhealth.ca or info@pinpointhealth.ca. Number's still the same, though, 1-855-55 Lou, DRLOU. So lots of stuff going on there. By the way, the social media is really ramping up, and there you can watch all the videos, which are really helpful. You can also leave comments and ask questions there as well.
Absolutely.
So get involved, big time.
And actually through, especially Instagram, I've noticed a lot of people are messaging, asking questions, which is really nice. It's sort of a way to text message without me giving away my phone number. Right. So, definitely if people have questions, I'm very, very happy to answer them through social as well, for sure.
And a reminder, and I know you mentioned this when you first got the social media underway, if there's something you want to see, there's always videos posted up there, whether it's how to do proper deadlifts, or this week it was how to do a dead bug for your lower back and your core. You say, hey, I've always wanted to know how to do this.
Sure.
Dr. Lou, could you please post a video, and Adam or whoever the pros at your clinics will get right on it. Right?
And that's the advantage of this. Like, we're not, and there's a lot of people out there that are sort of an expert in everything on social media, where that's the person. I know that I'm not the best at every single thing, but I know that I have the best team, and I use those resources in order, like you notice, like Dr. Adam Wade, who's our clinic director up in Newmarket, has been making some incredible videos for us, which are great to have for that stuff. So I know that there's people that are better than me at these things, and I make sure that I utilize them. I have an amazing team. Just reach out and ask. Sarah, good morning. How are you?
Hi, how are you?
Excellent. What's your concern?
Well, I'm actually just calling. My mother just had a full shoulder replacement this week.
Yep.
And I was curious, as a family member, what can I do to assist in her therapy to make sure that it moves smoothly?
Make sure she's doing the stuff. That's one big thing that I find with people is they often, it's good if family members just make sure to continually encourage that they're doing the exercises and things that they need to do. The other thing is to make sure they're not doing too much. She had the total replacement because it was very arthritic.
Yes.
Yeah. So, and how's her range of motion right now?
It's limited. She's in a sling for the recovery.
Right. Yeah. And how long have they recommended she stay in that sling?
I think it's 6 weeks.
Yeah. So at that point, for sure, she'll have to start doing the rehabilitation, and I think it's just a matter of living within that moderation, right? Like making sure that you are doing the things that you need to do, but also making sure that you're not going overboard and doing more than you have to. My mom actually had a fall a few weeks ago, and her shoulder's a little bit messed up, and she needs to relax right now. And every time I call her, what are you doing? She's like, well, I'm cleaning, I'm doing this,
cooking,
and I'm like, what part of relax did you not understand, right? So I think especially with parents, that's the biggest thing, is keeping them in that zone where it's like, make sure they're doing something, but make sure they're not overdoing it as well. But I think that's all that you have to do, because the professionals that she's going to work with are going to show her the right things to do.
Okay, great.
Okay.
Thank you so much.
No problem. Good luck.
Thanks, Sarah. Appreciate the call. And you want to reach out further, again, pinpointhealth.ca, info@pinpointhealth.ca, or 1-855-55. Dr. Lou, mother-in-law, perfect example, right? Goes for physio. Sees a friend of yours, right? Comes back in the week. How are you? I'm a little sore afterwards. 10 minutes later, she's slugging these massive aluminum pots. Typical Guyanese mother-in-law. Cooking curry for everybody. Like, dude, what are you lifting those for? You just got out of therapy. And you're complaining.
The other thing, though, is once you get into especially the elderly population, the biggest thing is they still need to feel that there's a purpose.
Yeah, they're necessary.
And that's the other thing. A lot of the times, that's why, you have to take that into consideration. Yep. To tell someone and say, like, I know we all think like, oh, I can't wait to retire and do nothing. It's like, yeah, until you get there. And it's like, doing nothing is pretty horrible, right? Like, that's why, the worst criminals in the world are in solitary confinement 23 hours out of the day, because that's torture. And to not be able to do anything. And I think that's also what family members have to, and you're talking about your mother-in-law right now, you have to take that into consideration. Mm-hmm. It's also the purpose that she has. That's what she wants to do. And, it's a matter of managing it. But that's like, it's like there's the good and the bad and the bad and the good. Like, right. You got to sort of look at it and say, okay, well, it might not necessarily be good for the issues that she's getting the therapy for, but maybe from the mental perspective, the psychosocial perspective, it's very important there. So I guess the question is there moderation available? And looking for that moderation. Same thing with my mom. Like, I know that my mom needs to do those things to feel purposeful. So, I sort of suggest to her, okay, well, like, today, instead of going, my mom's typical, like, old Italian mother, top to bottom, like, you could eat off the floor. And it's like, well, maybe just do one section today, like, and stop, versus, like, she cleans the house every single day. It's like, it didn't get dirty,
right?
It's
not
like
a hotel.
It's fine, right? And so, so I, and she's been like, okay, yeah, I'll do that. I'll just do the living room today or whatever. So it gives her sort of that purpose that she needs, but it also modifies the extent of the rest period that she needs for her shoulder.
Because sometimes eventually they're going to be forced to it if they don't just kind of back off a little. And right?
That's why a lot of times, right? Like, how many times do you hear that, oh, that person retired, stopped doing, and then boom, they're gone, because that sense of purpose is very important. And that's why a lot of these things, once these injuries become, if they ever become very severe, that's a dangerous thing, because then if they become immobile, they lose their independence, all these things, then that purpose is lost, right? And that's a dangerous thing on the psychosocial side, I think.
Good for another week. I want to carry on from here. It's very simple to reach out, 1-855-55 Dr. Lou, DRLOU. If you haven't grabbed onto the social media aspect, you should, because it's full steam ahead, man. PinPoint Health is where you got to search on social, be it Facebook or Instagram. Instagram's a good one because a lot of great videos up there for you to have a look at, learn from, and put your comments if there's something you want to see as well. Dr. Lou will get it up there rather quickly. So until next time, PinPoint Health Show right here on Global News Radio.